In the state of Wisconsin, some family caregivers are considered frontline health care personnel. That designation is important. It puts some family caregivers in the phase 1A group to get the vaccine. The COVID vaccine is being distributed in Wisconsin in a phased approach. Vaccine supply is limited, so vaccinations are targeted to specific groups in an effort to best protect the people at higher risk for COVID infection. In this video, we define frontline healthcare personnel, explain how some family caregivers are included in that definition, talk about how you can help spread the word on these priorities, and where to go to learn more. Let's talk about frontline healthcare personnel. It's the first group to get the COVID vaccine, that phase 1A group. The definition includes people who work or provide direct patient services. It also includes people that are coming into close contact with patients who could transmit the virus. So you're right to think about doctors, nurses, COVID testers, and other healthcare personnel in that definition. But it also includes direct care personnel and people providing direct care to patients, including in a home environment. This could be personal care assistants, home health workers, adult day service providers, and paid or unpaid caregivers for people in the family care partnership, and IRIS programs in the state of Wisconsin. It also includes those paid or unpaid caregivers of children in special needs programs. This includes the children's waivers, the Children's Community Options Program, Birth to 3, Children with Medical Complexity, Children Come First and Wraparound Milwaukee, and the Katie Beckett Medicaid program. Here's why we need to spread the word. First of all, some of these paid and unpaid caregivers are not aware that they are actually in this higher priority phase. Some providers, public health departments, or medical clinics, or the people administering the vaccines aren't aware of this designation either. And when the phases were originally published, there wasn't immediate clarity on who was included in phase 1A. So advocates encouraged the Wisconsin Department of Health Services to make those clarifications and ease the way for vaccinations to be given to those caregivers. So now we need to make sure that both the caregivers and the vaccinators are aware. Now let's talk about phase 1A, who's not included. And it's not the program participants themselves, it's the caregivers for those participants. The participants themselves are going to be in the next group when that is available. The state has identified March 1st as a target date, but again, as supply is available. Priority will still be given to earlier groups until they're caught up, until we can move on to future phases. And once we hit March 1st, not all Medicaid members are included in that next phase. It's going to be those enrolled in those Medicaid long-term care programs like Family Care Partnership and IRIS, and some of those children's programs like the Children's Long-Term Support Waiver and Katie Beckett Medicaid programs. But again, remember, there is an age requirement for the vaccine, which is age 16. Now, creating the phases, let's refresh our memory really quickly on why we created these priority areas in the first place. First, the state of Wisconsin does have a state disaster medical advisory committee. It's a standing committee that advises the State Department of Health Services, traditionally on medical ethics during declared disasters or public health emergencies. It recommends policies to help with fair, equitable delivery of medical services, especially when resources are constrained. They have a vaccine subcommittee. It was established to help the Department of Health Services develop guidance for how to allocate limited numbers of vaccine doses during this COVID pandemic. The initial quantity of doses available does not meet the need. We've been hearing that, and we know that's going to continue. Production and distribution aren't yet available in the amount sufficient to meet the need. The vaccine subcommittee took guidance from the Centers for Disease Control and the Advisory Committee on Immunization Practices on who should get the vaccine and when. And that's why Wisconsin created the 3 distinct phases, the phase 1A group, phase 1B, and phase 1C. Now, here are some key takeaways. First and foremost is patients. These are priority populations, like we said, but actual vaccinations and supply is limited. So this is going to take time. Understand, second of all, if you meet the definition for phase 1A caregiver, or if maybe you fit better into one of the later phases. And then, like we said, help spread the word to families, to providers, and to other vaccinators. You can use the state of Wisconsin's website for guidance, and we link to that in the description below. You might also find your local county public health department's website to be quite helpful. They've been posting frequently asked questions and where to go to learn more.